Thank you. So, good morning, everyone. My name is Camille Bellet. For those who don't know me, I work as a researcher at the Institute of Infection and Global Health in the University of Liverpool in the UK. I'm a veterinary and epidemiologist from background, specializing in the sustainability of agri-food systems and public health. And I'm particularly interested in the governance of farmed animal health and production, and more specifically on the relationship between farmed animal health, politics, and public health. And today I'm going to talk about the particular context of veterinary vaccine development in livestock systems in Europe in the frame of the SAPHIR project. So, as you probably know, since the 1950s, there have been significant advances in animal production with the development of new technologies and the modernization of animal husbandry. This was underpinned by significant advances in the animal sciences, in particular genetic selection, improved nutrition and health, husbandry and housing, as well as different political choices in the food industry. And thanks in good part to technologies, animal production looks today radically different from what it was just a century ago. And technologies continue to play an amazing role in defining the future of animal farming, as we can see here, actually, in EuroTier, with the place given to technologies. Just looking around us when we arrived in the different conferences hall, or reading through the technical and innovation programs of EuroTier, improved animal farming seem really connected to things like digital animal farming, for instance, the digitization of production processes in the farm and on the barn, new cell phone apps, sensors for animal performances and health monitoring, as well as new robots for milking, new feeds, and new vaccines and new drugs. As we can see, the word technology covers huge variety of tools, instruments, products, processes, even materials and systems. And animal farming today is increasingly governed and shaped by it. Well, these technologies have changed agriculture and animal farming and the world, and continue to change it. And the reinvented world, if I may say, changed us at the same time. With the Industrial Revolution, traditional farming systems have gradually been replaced by large industrial enterprises, technically and mechanically sophisticated. Yields and productivity has increased, speed, world connectivity, and complexity of the food system from the farm to the fork as well. And occupation of spaces and landscape have changed, driven by new dynamics between the rural and the urban activities in the food industries. And technologies have penetrated the routines of agricultural daily life and animal farming. They have changed minds in the definitions and the conceptions of animal farming, and they have changed the social interaction we have within animal farming, with food, with animals, and with the environment. And basically, we even hardly notice the countless instruments and invisible networks that actually govern current animal farming and food production, shaping what we do and see as a farmer, what we smell and eat as a consumer, what we know, what we believe. And there have been, of course, technologies, a big source of progress in terms of development, of health, hygiene, and ease of life. Yet technologies are not without problems. And resuming the categorization of the problems related to technologies and animal farming today, made by the sociologist Shela Jasanoff, the first is risk. Our appetite for very cheap, numerous, easily accessible and seasonal food have actually created, for instance, a model in the food industry where chronic production diseases have increased in animal farming, such as coccidiosis in the poultry sector, and chronic respiratory diseases in the cattle sector. This also has created a model where animal production have become more dependent to drugs, and as a consequence, drug-resistant pathogens have become more numerous as well in the environment. The second persistent problem of technologies is inequality. We often forget it, but technologies are used by many people, but actually the way they can be used is not the same for all. In the 20th century, for instance, processes of industrialization in the global north, expansion of livestock trade and creation of new vaccines that were increasingly efficient, safe and convenient in terms of use, have made vaccine the answer for a lot of diseases. And for instance, FMD. And disease and vaccination status became a kind of official regulator of trade and access to trade. Yet the legitimacy of the regulation standards for FMD are debatable today, and the operationalization of FMD control, thanks to the vaccine, is also different for everyone. It may reinforce cleavages between more or less developed countries, more or less powerful actors. And finally, the third problem concerns the meaning and value of nature and the meaning of the human nature as well. Technology change who we are, and in the case of animal farming, how we produce, what we eat, and how we live with other lives on Earth. So we live in a very complex world where the same technology and model in the food industry, like vaccine, can be found, but people experience them differently depending on where they live, how much they earn, their education, their human values, and what they do for a living. And these two figures were taken from the EuroTier website, just to show, for instance, the spectrum of geographical and occupational origins of the people attending this specific fair. So now one of the questions is, well, considering all this, the drivers for the development of new technologies, the effects of the technology on the environment where it is integrated, the change that the technology will produce in lives and the risks it may also create, whose duty it is today to anticipate and prevent the negative effects of a technology. Do we possess the necessary approaches, the tools and instruments for knowing the need for and the value of a technology in animal farming, and to predict and prevent its harm on the environment and society? Given that every case is different, I will now continue the talk with the particular example of livestock farming in Europe and the development of health technology, more specifically new veterinary vaccines against chronic livestock diseases. So, drawing on the analysis of the current literature, we wanted to explore the feasibility of informing relevant livestock health interventions in Europe for 3 major chronic diseases in cattle and pigs and broiler chickens. And this means that we wanted to explore whether the data available in the public domain allowed us to assess the viability of livestock health interventions in Europe against these 3 chronic diseases. And in doing so, we wanted to expand the current debates on the complexity of assessing and understanding chronic diseases in livestock farming and finding viable and sustainable health solutions, including political ones, for the food industry and society. So our search of data in the literature related to the fact that to decide whether or not to intervene against a livestock disease, we first need to understand the effects of this disease on the animal, its growth, its behavior, its reproduction, and well-being, and see how these effects may be detrimental to the quantity and the quality of the food produced, as well as the animal and the environment. It is also necessary to understand to what extent the disease is likely to generate more production costs, the time an animal will spend on the farm more because of the disease. Importantly, we considered the fact that each geographical region and country, livestock systems and farms follow strict procedures complying with technical and technological means, production objectives, and principles of good local practices, which may influence the occurrence and the effects of specific chronic diseases and the benefits of their management. And as mentioned earlier in the talk, whatever the decision made by a farmer or the industry to overcome the effect of a livestock disease, the decision also taken by them will have some effect, whether you decide to ask for some veterinarian advice to treat with drugs or to vaccine, and the activities of them will change as well. Rapidly, the analysis of seeing the data publicly available on these livestock chronic diseases in Europe focused on the 12 main producers of cattle, pigs and broiler chickens in Europe, and the most common etiological agents for chronic respiratory diseases. You have the countries on the left-hand side and the 3 main disease, and then the colors, the reddish represent data related to the presence of the disease, which I summarize by frequency, severity, which is most of the data reflecting presence of disease in the literature, and then in green, everything related to effects on production and also management. The white are the countries not included for the given disease, and the black is where you don't have any data. So basically what we observed was that many quantitative estimates exist on very specific aspects of chronic livestock diseases. When you have a color, it's because you have some data. Now, the importance is to understand what type of data we have. And basically, what we observed is that the data that exist remain of limited interest in judging the relevance and viability of livestock chronic health decision nationally and at the European level, considering all what I discussed just before. And the data publicly available are mainly related to the presence and severity of the disease, what I would call case report, prevalence and incidence data, but rarely to the relationship of the disease with the environment and the effects of disease on the management and the effects of their management. Moreover, research on livestock health has a strong focus on the development of technological solutions to tackle chronic livestock diseases, such as drugs and vaccine. However, such a trend is never accompanied by deeper analysis on the effects of and the changes produced by these technologies on the environment, which are key to inform and shape sustainable health policies. Overall, what we observed is a lack of access to private health and industrial data by the public sector for deeper analysis and wiser response to chronic livestock health management. And a current research on livestock health that is mainly focused on technology development that may skew decision-making towards a productivist model in the food industry. Over the years, the private sector has increased its role as a data holder and decision maker responsible for the monitoring and the management of chronic livestock health on farm. And I weigh the word chronic as opposed to acute or emergency case of livestock diseases. This has allowed the public sector to limit its involvement to the management of notifiable and emergency livestock diseases such as avian influenza or FMD, as I mentioned earlier. And there is no need to challenge this focus. Yet it could also be justified to try to increase investments from the public sector in less contagious and more benign chronic livestock diseases in animal farming as a way to promote the viability and the long-term sustainability of livestock and the food industry in Europe. And moreover, if the research in animal health sciences is part of a long tradition of evidence-based medicine that promote some scientific health disciplines and exclude others, which overlook fine-grained social and economic understandings of livestock health and animal farming, underestimation of the problems related to livestock chronic diseases by the public sector will remain. The idea then is to try to give more equilibrium into the participation of each sector. Of course, this is not easy. I can see already Jean-François with his eyebrows. Yet, this needs efforts, of course, but it's a need, a requirement, if we really want to work towards viable solutions in animal health, animal farming. There is a need to align incentives of interest between the different sectors and to do meaningful political actions based on our conversation with each other and communication. The importance of these observations, again, are not to point to the obvious, not enough research, not the right data, but rather how we can improve so that the future generation of policymakers have a better basis for disease management in the livestock sector and resource allocation between livestock diseases and within individual disease management programs to guide sustainable health and food policies. This is not only about health animals, it's about the sustainability of our food production in the environment. And creating resilient collaborations, partnership between the public and the private sectors, whereby opportunities are given to the livestock industry to collaborate with health professionals, such as veterinarians or pharmacists, and the public sector is key to understand how livestock disease and disease management strategies function in the context of the food industry in Europe and make more viable and sustainable resource allocation decisions. This mirror, and I'm not going to talk too much about it, the work we are currently doing with the work package 15 of the SAPHIR project in the poultry, broiler, chicken, pig and cattle industry, and also our recent initiative based on these observations we made through the SAPHIR project around the global burden of animal diseases. And they require true interdisciplinary and transdisciplinary transparency and cross-sectional partnership between the industry, research, governments, and of course society And with this, I thank you.
Wow. I think we can spend a whole session on this subject. Is there any question from the audience? Yes.
Nice presentation, Camille. Regarding the available data on occurrence of respiratory disease, what was it in cattle, pigs, and enteric disease in chicken, and then the available data on effect of vaccines or control measures, how did you screen the literature? Was it a scientific reports or also technical reports? Was it only from the last years? Because I saw for pigs in France, there was no data available on effect of control measures, where I have some studies in mind where effects have been assessed, but it's already quite some time ago. So I was wondering, how did you check the literature on that?
So first, for the literature in France, it's only no data for chronic respiratory diseases in pig. Yeah. So the literature was, so we based our review on 2 bibliographic databases, Scopus and Web of Science, which are important databases for scientific communities. This doesn't exclude any bias, of course. And then we included all peer-reviewed literature, policy reports, theses, grey literature. When I screened all the document, I looked at the abstract, the title, which had to agreed with some inclusion criteria, such as the disease and the geographical place. And then, depending on that, I read all the documents. I had in total 133 documents, which include all the documents from the databases and also some cross-tracking with the references included in this paper for other additional paper to include. All the data, and you again taking the example of France and the pig sector, about effects are related to either the effects of a vaccine trial on the production outcomes of the animal, not at all to productivity changes in the livestock sector, and not giving information on the current interventions existing. By that, I mean precise information on what farmers are currently doing on farm, and if they have some percentages of vaccination coverage or drug use, they're only related to specific livestock systems in the particular case of the population sampled in the study. So by that, I mean that there is a lack of data. These data doesn't allow us to use them to be able to have robust estimation of the impact of the disease on the animal and on the farm where the animal is living and on the entire pig sector, in this case, in the country where we are focusing.
Thank you very much.